Hello, I'm Professor Ewan Forrest. I'm a consultant liver specialist based at Glasgow Royal Infirmary. Alcohol in Scotland is a lot more affordable and accessible, or was a lot more affordable and accessible than it was previously. Alcohol maybe at one stage was for high days and holidays, but we were finding, particularly in the sort of late 80s and 90s into the 2000s, that alcohol was becoming sort of a fairly constant and ever-present feature of life in Scotland, which unfortunately ultimately was having significant health effects. Yeah, liver damage is something which happens silently. Most people who develop advanced liver disease don't get an early warning of the process occurring. And this applies to lots of types of liver disease, including alcohol-related liver disease. So people can be damaging their liver without being aware of it from a day-to-day basis. Which means that when the liver does get to a point when it can't cope anymore, when somebody develops essentially liver failure and need to come to hospital, they often have extremely severe advanced disease of which they were unaware until that point. And the tragedy is that if somebody does come into hospital with an episode of liver failure, the death rate from that hospital admission is tragically very high. So clearly, the best way of addressing this problem is to not wait until someone develops symptoms or develops features of liver failure, but to identify the liver condition earlier, and ideally to prevent it evolving and developing into that advanced stage. So prevention undoubtedly is the best way forward. Public health measures such as minimum unit pricing is extremely useful in addressing that problem.